Bismillahirrahmanirrahim. Here is the examination of ENT. In general examination, there is introduction first of all, then the permission from the patient, and proper instruments should be sterilized, and proper position of the doctor in relation to the patient. The patient chair should be rotatable. Patient should be at eye contact level with the doctor or the examiner, and the instrument trolley is present in that room, and the nasal forceps, Tilly's nasal forceps and crocodile ear forceps in instruments are included, and then headlight for the both hands to be free, light source and mirror adjustable in the case of headlight. And then in the children examination, both the hands of the children are held by the helper, and are with the from the help with the relative, and put other hand on the head of the child to examine the ear, to examine the canal. And first of all consent, and then inspection, and then palpation. And pinna is visible clearly in examination, tragus and antitragus. So here this part is the helix of the ear, and this inner part is the antihelix, and this is the anterior end of the helix here, and here is the tragus, and also here present, just like this structure here present the antitragus. And this is pre-auricular area, and behind is the post-auricular area of the ear. What is the bat ear? Bat ear is only helix is present and antihelix is absent. If antihelix is no more present, if this structure antihelix is not present, then it is bat ear. Only helix is present, that is the outer border, only helix is present, then it is bat ear. And if any problem in preauricular area, it might damage the facial nerve. And if inner ear is present or not, how we will detect? We have to do the tunifork test and CT scan to detect that. If outer structure is absent, suppose that pinna is not present, or there is rudimentary structure is present only. So how we will detect that? If pinna is absent, then whether the inner ear is present or not, we will do the tunifork test and CT scan. And after, if inner ear is present, then we will do the pinnaplasty to make the pinna again, and functional ear will be there. And if there is hole on the interior end of the helix, this is helix outer border. If at the interior end of the helix there is the hole and discharge from the hole, this is known as the preauricular sinus. And sinus is that has only one opening, while the fistula has the two openings, and sinus is just like a sac like structure. So this is the preauricular sinus here in front of the anterior end of the helix, hole present, it is preauricular sinus, before the auricle sinus. Sinus is a sac if only one opening is present, and in fistula two openings are present. Swelling, there might be swelling due to lymph node or the facial nerve involvement, and as there was a hole, there might be swelling around the ear. And then post auricular groove mean behind the ear, in this area behind the ear, post auricular groove. There might be problem with post auricular groove, there might be swelling, or post auricular circus is absent through which the ear is attached with the skull posteriorly. Post auricular circus might be absent, or maybe due to mastoid involvement. How we will detect that mastoid is involved, or it is a skin problem? If skin is involved and lymph node involvement, then no symptoms related to ear, like pain in the ear or problem with the hearing, if only skin is involved. But if the mastoid is involved, then there will be the symptoms like of the ear, pain in the ear, and symptoms related to the ear if the mastoid is involved. To examine the ear, to examine the external auditory canal or external auditory meatus, we will pull the pinna upward, backward, and laterally outward. UBO upward, बाहिर upward ऊपर की तरफ, फिर पीछे की तरफ और बाहिर की तरफ laterally, upward, backward, outward. To examine the external auditory canal, we will pull the pinna of the patient upward, backward, and outward. And what is the difference between the outer 1/3 and inner 2/3 part of the external auditory canal or the external ear? The external part is 1/3 and the inner part is 2/3, and the external part of the external part of the external ear is the cartilaginous part, and it is lateral and consists of glands and hair, while the inner part, internal part, is the cartilaginous. Inside the towards the external auditory canal is the bony part, and it is medial part, and no glands and no hairs are present in the internal part. And so in examination, we first of all we do the inspection only to see the pre-auricular area and post-auricular area. Mean here the pre-auricular and then post-auricular area, to observe the any kind of swelling, any kind of trauma, scar in the pre and post-auricular area, in front and behind the ear. And inspection of the external auditory canal, then palpation by touching, and then examination of canal, external auditory canal and the tympanic membrane, which is also known as the eardrum, without speculum and with speculum. First of all without speculum and then with speculum. Without speculum by pulling the pinna upward, backward, and outward, and then with the speculum. Why we do this examination of the ear? For detecting the balance system, hearing system, and facial nerve intact or not. And never forget the 3 F's: fistula test and facial nerve. And then we perform different tests: Weber test and Innis test, for detecting the functioning of the ear. And Weber test: put the tuning fork on the nasion or teeth or the vertex. These are the bony structures on which we put the tuning fork, and this test is used to detect the better cochlea. And conductive deafness is present if defective. So in the defective ear there will be more resonant sound, and it will detect the conductive deafness. In the case of Weber test, it is used to detect the better cochlea, but in the defective ear there will be more pronounced or resonant sound. And then Rinne's test. In this test we put the tuning fork on the mastoid bone first, and then in front of the pinna, to detect the air conduction and bone conduction. On mastoid bone we detect the bone conduction, and in front of the pinna we detect the air conduction. Normally the air conduction is better than the bone conduction, because first of all when we put the tuning fork on the mastoid bone, the vibrations will be and detected by the patient, and then we put the same vibrated tuning fork in front of the pinna. Vibrations will be present at that time also, so the air conduction is better than the bone conduction, because air conduction is still present after a long time. Rinne's test is positive in the case of normal, and Rinne's test is negative in the abnormal case, in which bone conduction is more than air conduction. And then Weber test. Weber is lateralized to one side. If there is abnormal Weber test, then we say that Weber is lateralized to right side or the left side. Which side is defective? Then there will be the more sound on the defective side, because we have discussed here that more sound on the defective side. Then we put the tuning fork on the nasion, teeth or vertex in the Webers. And then problem with the ABC or Rinne's or Weber test we can detect. And then balance is associated with the eye, ear, joint and musculoskeletal systems, or problem in the brain. Then balance test we can perform: Romberg test and gait test. and Unterberger test. In Romberg test, we ask the patient to stand up and uh, then close the eyes, and if he falls down after closing the eye, then there is a problem, and it is done in the Romberg test, and gait test is also performed. And then to perform the fistula test, we use the Seagull speculum. Spelling will be Siegle, Seagull speculum, Seagull pneumatic auricle speculum, in which there is balloon first of all present, then the connecting tube, and then magnifying lens, and in front speculum. And also this Seagull speculum is shown in another video that is present on my another channel. You can see by searching the ENT instruments on Dua Nadeem channel. And here are the balloon to create the pressure and magnifying lens. If nystagmus is noted, then it shows that fistula is present inside the ear and test is positive. It is used to detect the adhesions of the semicircular canal, that if the semicircular canals are normal, then there will be no nystagmus in the eyes. And Seagull speculum is used to perform the fistula test to check the mobility of the tympanic membrane. And then examination of the nose. First of all, we will do the inspection, and then gentle palpation of the nose, and then examination of the paranasal sinuses, in which the maxillary sinus and the ethmoid sinuses are included. And they are the different kind of cartilages, upper lateral cartilages and lower lateral cartilages of the nose, and here the nasal bone. And in examination of the nose, we do the inspection and then gentle palpation. In inspection, we note the shape of the nose, any deformity of the nose, straight nose or hump of the nose is present, or depression of the nose is present. Then examination of paranasal sinuses, frontal sinus, ethmoid sinus, and maxillary sinus. And any scar, mark on the nose, or ulcer, or tumor, or anatomy of nose is detected in inspection. So inspection, then gentle palpation, then examination of paranasal sinuses, and then nasal tip elevation, and anterior rhinoscopy and the posterior rhinoscopy. And in posterior rhinoscopy, we use a stepped mirror. And functional examination of the nose, we do two things: the breathing check, and olfaction is checked, that breathing is normal or not, and olfaction is normal or not. If there is no olfaction at all, there is no smell detectable by the patient, then it is known as anosmia. And if the olfaction is reduced, then it is hypoosmia, and there is more smell is detected by the patient, or abnormal sensation, then hyperosmia. And here, when we also see the lateral and medial cruras